So I'm gonna perform a BiPAP initiation. Before we put this one to the patient, make sure we check the patient's chart, obtain any relevant or important information. Once we're about to go inside, sanitize or wash our hands, apply PPE, and then we introduce ourselves, check the patient's ID band, make sure we also obtain vital signs, listen to the breath sounds, and also we also have to explain to the patient what we're trying to give to them, what therapy it is, what's its indications. And also another important is like we also have to let the patient position if they are able to in an upright position, or if not we can just try to elevate their head from the bed. And then after that, we have here mask. So with the mask, make sure we have at least different sizes with us to make sure that we're able to prevent ourselves from having going back and forth to the department. So with the mask, if measuring it up to the patient, make sure we have that measurement width with kind of a ruler where we have to check the patient's nose, what size it is, what's the width, the depth, especially in the sides. That way we can determine what's the appropriate size for the patient. It's either not just for the nose, but also we can also have it with a full face also. So especially if we want to hook this one up, assuming this one is inserted to the patient, so we can immediately put this one to the patient. But prior to that, we have to turn this on. So this one is a BiPAP focus respironics machine. So we'll take a few seconds, and then prior to that, we also have a clean corrugated tubing with us with a bacterial filter. So it should be inserted tightly. It should be secured, and then this one is a kind of oxygen valve. And then with the corrugated tubing, make sure it's not kink. And then also there should also be for example like a pressure monitoring port where it will measure its flow or pressure from the patient. So with this machine there is no calibration, unlike with a mechanical ventilator. So we can know what mode it is by checking the mode on the top, and then it should be shaded black. So if we want to change this one up, we should press enter, and then we can try to change it up either CPAP or spontaneous time. So for example, if we want to put in spontaneous time, we should hit enter, and we also will see the different parameters or settings such as the IPAP or EPAP, if what problem the patient has, either